Great.
All right, well, good afternoon. Welcome to our second Facebook Live. My name is 𝗧cie𝗽𝗶𝗰𝘀, and I'm pleased to be joined once again by Dr. Bredesen. Welcome, Dr. Bredesen.
Thanks, Kaylee. Good to talk to you.
Well, today's topic is not only of great interest to the NeuroQ community, but I'd say society as a whole. We are in year 3 of one of the most historic and impactful pandemics to date. And although it seems like we're coming out of the other side, there have been studies and research showing startling effects from COVID lasting well after the initial infection. And some of the lingering effects from COVID are affecting us neurologically, right? And so from slight brain fog to full-on cognitive decline, the effects of COVID on our cognitive health is really of great concern. And so, Dr. Bredesen, can you just give us, an overview of how and why COVID may be affecting us neurologically?
Yeah, that's a huge point. And of course, there are now whole clinics devoted to long haulers COVID. So it is true that not only acutely, but also chronically, there are so many different symptoms. And often, as you said, they do affect the nervous system. So there are all sorts of things that happen with the nervous system. There are, for example, there's Guillain-Barré syndrome, which is a paralysis, which fortunately is slowly over time reversible typically. There's, of course, Bell's palsy. And so where you get facial weakness on one side. But of course, the most common, and of course, we've talked a lot about loss of a sense of taste, loss of sense of smell. These are all so common. And unfortunately, one of the very most common is brain fog. And there's a big concern about whether there's going to increase the risk for dementia. Now, unfortunately, as you indicated, COVID affects the brain, and it does so in multiple ways. So one of the things it does is it changes clotting. And this is why you actually see tiny, tiny areas of infarction. So in other words, loss of blood. You see it in the heart, you can see it in other organs, and you can see it in the brain. You actually see specific blood cells enter that are associated with clotting. You actually see damage to the endothelial lining, so the lining of the blood vessels. You also have a change in your autoimmunity. So your immune response changes. And so you can get various autoantibodies, just as someone would get, for example, with lupus, that sort of thing. And then in addition to all that, some groups have reported direct infection of the brain. Others have not reported that. But the bottom line is you have immune changes, infectious changes, thrombotic changes, and all of these combine to give you these multiple syndromes. And unfortunately, cognitive decline is a concern. Now, there have been a few patients who've developed Parkinson's, but so far it doesn't seem to be many. There were initially 3 recorded. I've talked to some of the Parkinson's experts recently who aren't seeing a lot of additional Parkinson's. So hopefully that will not be something that we see in the future. But there is still a concern for cognitive decline. And therefore, we recommend that anyone who's had COVID, with or without brain fog, please get on active prevention of cognitive decline so we can minimize the risk for any future cognitive decline.
So on that note, talking about, the protocol and really kind of working with the symptoms of COVID, what are generally the common symptoms? I know you mentioned brain fog, but from kind of more minor to severe, do they range in differences, or are people generally experiencing some of the same things?
Yeah, you hear the same sort of thing again and again. Now, you're right. Some people will really have problems, and certainly some people will now, go on, especially if they were in a pre-dementia state anyway, they will get worse. And as we know, people who have pre-Alzheimer's or Alzheimer's, so things like so-called mild cognitive impairment, which, as some people say, there's nothing mild about it, but MCI or dementia, will often experience a dramatic worsening when they have infection with COVID, unfortunately. But in general, what people will say is they're just not as sharp. They can't attend, they can't focus the way they did before. They can't multitask the way they did before, and they can't remember things as easily as they did before. So pretty typical symptoms that we would associate with brain fog. They just feel like they're not all the way back. So they need to be sharper in their everyday work, in their, in their jobs, at home, that sort of thing. So that's those are the typical symptoms that people complain about.
Right. Well, and it is very interesting. I feel like there's more and more coming out that what people mistaken as common brain fog is actually this lingering effect of COVID.
Yeah.
So now that we're kind of understanding how COVID affects us neurologically, what are some of the ways that we can, start mitigating some of these symptoms?
That's a great point. So it's interesting, when people have looked at long COVID, in some cases, it actually seems to get better by activating the adaptive system, which actually makes some sense, which suggests that it's about clearing the virus. In other cases, it seems that it's more about autoimmunity. So you have to really reset the system. You have to look. So starting by, remember when you have COVID, you have this mismatch between the innate system. So you've got the ongoing inflammation and the adaptive system, which is failing to clear the virus. If you clear the virus and bring down the innate system, things are good. So you're going to need to quiet the innate system and bring up your adaptive system. So that means, number one, making sure you've got enough zinc. Number two, making sure you have enough vitamin D, the kind of the typical things to prevent a poor outcome from COVID. And then it means bringing down that inflammation. So for most people, that'll mean making sure that you've got enough omega-3s, making sure that you've got enough pregnenolone. So for those of us who are challenged with our adrenals, whose adrenals are not working well, who are not putting out enough cortisol and enough pregnenolone, actually taking small amounts of pregnenolone is not a bad idea, but good idea to check to see, are you able to make that? As you know, some people require dexamethasone because they are having a cytokine storm. So again, we want to bring into balance. We want to improve the support for your adaptive system. We want to damp down on the innate system. That also, as I mentioned, the omega-3s, for some people, that means taking some SPMs, some of these specialized pro-resolving mediators, although those are derived from omega-3s. So if you've got good omega-3s on board, you're probably going to make enough of that. So, and then it requires resilience. And so getting the right amount of sleep and not too high on the stress levels, having appropriate nutrition. And then it includes supporting critical players in your brain. Things like having enough brain-derived neurotrophic factor, which some people use through whole coffee fruit extract, obviously is part of NeuroQ. And then having enough curcumin to damp down some of that inflammatory process. Propolis, again, damping down some of that inflammatory process. And then having appropriate cholinergic tone. And so for some people, that would be huperzine. For some people, that would be acetylcholine or alpha GPC, any of those to get your choline level. So in other words, you've got to get the support right. You've got to get the immune system right. You've got to get the cholinergic system right so that you can learn new things, because that's a critical part of that. And you've got to get your resilience there. So you don't want to be staying up all night. So this combination of things gives you, the best system overall that is working to keep you in good health. Now, if you do really have many symptoms of long haulers, then you want to go into a long haulers clinic and find out, is this the sort of thing where you have an issue with you actually need to have an additional vaccination or booster? Is this the sort of thing that you actually want to have antiviral treatment? So for most people, they won't need either of those things. But again, for some people who have really serious long haulers, then those may be included.
Right. Well, and what I love about these conversations is, when we talk about whether it be, your typical age-related cognitive decline or, COVID-induced cognitive decline, it's not this one-size-fits-all answer, right? That there could be a myriad of solutions or things that we need to be doing, and it's not just this one thing that will work for everybody. And so I really appreciate that response. And kind of delving into that, we have a couple of questions from our community that I'd love to go over with you. And the very first one, and this was a repeat question, which is really interesting. This is from Rita. And her question is there a certain variant of COVID that has been shown to have more cognitive effects than others?
Yeah, and as I mentioned before, that's not known yet. So there aren't data yet. In general, the earlier ones were more severe. So in that sense, yes, it's a more severe disease. As you know, I mean, a lot of people now know people who are getting Omicron. Of course, today it was announced that Vice President Harris, despite vaccination, had tested positive for COVID. But what we've been seeing is that people get it more easily and they get rid of it more easily. So it does seem that as we go from variant, as we go from the original ones, we go to Delta, and we go to Omicron, and then BA2, et cetera, we seem to be seeing situations in which people are doing better with it. Now, does that mean that the long-term problems will be less? We don't know yet. So if I had to guess, my guess is going to be that you may see more problems with long COVID, including brain fog, with some of the earlier variants and less with the later variants, but the data are not in yet.
Right. Well, and kind of piggybacking off of that, and I know that you talked a little bit about this, but one of our other questions comes from Michael, and his question is, has there been any research to show that the vaccine reduces the chances of having COVID brain, or basically the symptoms of cognitive issues with COVID?
Oh, absolutely. So there's no question that virtually all of the different outcomes have been lessened in people who've had the vaccination. So that includes brain changes, that includes heart changes. As you know, there are a few side effects that are associated. Of course, with the J&J vaccine, there was this question about venous sinus thrombosis. That was 1 in a million, so relatively uncommon. There have been a few cases of myocarditis and pericarditis, especially in young men who've had just the vaccine. But with those exceptions, virtually everything else, it's more mild if you've had it. And I went through this myself, being someone at relatively high risk. When after I got vaccinated a few months later, I ended up, unfortunately, getting Delta despite all the usual precautions. I did not have major issues with it, except, very briefly, and have not had any sequelae that I know of. And I will see in the long term, but I've not had brain fog. I've not had other problems. So in general, yes, to reduce the likelihood of getting these side effects, those who've had the vaccinations. Now, of course, people have ideas about whether they want to be vaccinated or not for all sorts of different reasons. And so, of course, I think it's up to each individual to make the decision. But if you just look at the data on the long-term, long COVID, and the severity of the side effects, people do better if they have had vaccination.
Excellent. Well, and our last question, and I think again this was covered in the majority of your response earlier, but for those who are experiencing, brain fog, is there or some of these symptoms, is there a timeline where it's time to go actually see a professional instead of really kind of taking on self-care, if that makes sense?
That's a great point. So if the brain fog is interfering with your daily activities, if it's making it tougher at work, if it's making it tougher at home, if it's making it so that you're having difficulty doing your daily activities, then absolutely it's a good idea. Now, you can take a first stab and do some of the basics we've already talked about. That's fine. Try it for a couple of weeks and see. Some people will get very good responses. But yes, if you have continued complaints, I recommend seeing a physician, and especially one who is familiar with long haulers syndrome and can potentially pinpoint. Again, we're talking about a system that works well together. You have to coordinate. You've got to have the appropriate immune function. You have to make sure that you don't have continued mild viral infection. You've got to make sure that your adaptive system is geared up, and that your innate system is not too much. You don't want to have ongoing lots of cytokine production. You want to make sure that that you continue to optimize your cognition as it is anyway, with, as we talked about, cholinergic and cholinergic support, trophic support, all the things we've talked about in relation to cognition in the past. But good idea if you're having ongoing problems, and especially if they're severe, to see a physician who has great expertise and experience with long COVID.
Excellent. Well, Dr. Bredesen, thank you again so much for hopping on and having these discussions. Again, for our community, if you are looking for more information, especially on Dr. Bredesen, you can go to apollohealthco.com or neuroq.com. We will have more newsletters and things that we can follow up with this. But again, Dr. Bredesen, really appreciate your time. And yeah, thank you again.
Thanks so much, Kaylee. Great to talk to you.
Have a good one.
All right. Stay safe.